enroll eligible children. It's an initiative that's about commitment, about energy, and about focus and accountability grounded in the data. And I think we all have a sense of urgency about this work. It's back to school week in many cities around the country. No child should be starting school this week unable to read his school book because his vision hasn't been checked. No child should be starting school this week unable to participate in a school sport because his family doesn't have affordable coverage and can't get him to a physical exam. Children can't wait for that coverage, and the good news is children don't have to wait. So now let me introduce you to the woman behind the challenge, a real leader, of course, in our effort to make sure that every person in America gets affordable, quality health care, and a real champion on behalf of kids. Secretary Kathleen Sebelius.
Well, thank you, Cindy, for that nice introduction. But more importantly, Cindy Mann does a fabulous job as the leader of the Medicaid and CHIP programs here at the Department of Health and Human Services. And I want to thank Cindy for her terrific work each and every day. I'm also really delighted to have a chance once again to be with a good friend and a great champion for children, Secretary Arne Duncan, who Arne and I have worked together on a number of initiatives involving children and healthy starts in life, and this is another of those joint efforts. And Dr. Jenny Kenny, who is the principal author of the new Urban Institute study we're releasing today. Dr. Kenny's study contains some really important information to help us reach and enroll millions of children who are currently eligible but not yet enrolled. And I want to, again, thank you personally for not only being here, but thank you for your important work. Nothing is more important to our future than the health of America's children. And that's why Medicaid and the Children's Insurance Program were created to help families who couldn't afford private health insurance get the treatments and medicines they need. And thanks to these programs, tens of millions of Americans today have the peace of mind that comes from knowing that their child is safe. If he or she has an accident on the playground or develops a fever in the middle of the night, they can be taken care of. Yet we know across America that too many children still don't have access to the care they need. It's why one of the first laws signed by President Obama was the CHIP Reauthorization Act, which gives states new tools and powers to expand coverage for kids. And it's why 2 weeks later, the President signed the Recovery Act, which again provided